I get to play with a creepy alien skull again today. Hey guys, today I wanted to talk to you about something that's super common. It actually affects around half of babies. The technical word is called Plagiocephaly, which is traditionally a more severe version. But even something as simple as just having a flat spot starting at the back of one of your baby's heads, or back of your baby's head on one of the sides. I wanted to talk about a little bit of things that you can do at home and some things that you can look out for. First, I hear all the time parents they feel guilty. They feel like this is something that they did. It's not. There are a bunch of external things that can cause this. There are some things that you can do at home to minimize, but most of the causes are not your fault. Things like how they were positioned in the womb. So if your baby was breech during pregnancy, if your OB told you that your baby is wedged into your pelvis, or if they've been stuck there for a really long time, sometimes the bones in your baby's head don't line up quite the way they should. That is one great reason to see a chiropractor during pregnancy. Another common cause that we see is a really traumatic birth. So the normal process that happens during delivery is we have all these relief joints in our heads when we're born. And as this baby comes down the birth canal, these bones actually squish together and overlap. It makes their head smaller, it squeezes their brain, it tells them that it's time to wake up. It's time to experience life outside of the womb. It's a very good natural process and is a great reason why vaginal deliveries end up with healthier kids. Sometimes that process can be traumatic, whether it's too fast or too slow. Maybe there was a forceps or a vacuum involved, something that traumatically injured the baby's head. These sutures might not line up quite as well. So that's another one of the causes. If you have twins, it's extremely common because obviously there's less room in the womb. One of the babies might be taking up more room than the other one. If your baby's born premature, it's much more common. Preemie babies have softer skulls, so it's easier for them to flatten. They often spend more time in the NICU, so they're laying on their back for longer times. And a lot of times preemies aren't physically developed as fast, so the muscles in their neck aren't allowing them to get up and move their heads. Things like torticollis. So if you're noticing that your baby is always turning to one side, that's a good way to see that obviously if they're putting more pressure on one side of their head all the time, then they're more likely to get a flat spot on that side. Some of these other ones are things that I see a lot. I'm actually going to do a video on this in a couple weeks because I'm very passionate about this one and I see a lot of people doing it and using them. Things like bumbos and incorrectly used baby carriers, bouncers, things where kids stand in them and walk when they're not able to walk. Those all can place a ton of extra stress on their systems and will actually create flat spots on their heads. If your baby had hip dysplasia and had to be in a harness, that's another common one that can cause some of the stuff. So some of those are external causes that we see a lot of. There are also a ton of internal causes, things like the dura and the tissues around their brain are asymmetrical. The sutures aren't expanding as well as they should. Things that I and we will look for in your child, things that are harder to find. So it's important to remember that the brain is actually doubling in size in the first year. So that means in 12 months, your baby's brain goes from tiny to big. Babies have huge heads compared to their body. Their brains are growing like crazy. It's because their brains are so important at this age. Since it's moving so fast, it's really cool because even if we have a flat spot, that fast growth can often mean that we can make fast change, which is really cool. So some things that you can do at home to minimize this if your baby has a flat spot, and things that you can do to prevent. The first and the last, I'm going to leave with the most important. The first one is to get them adjusted. If your baby's not seeing a specially trained chiropractor like us, I would absolutely highly recommend that to get your baby evaluated to see if there's more going on. Other things that you can do: changing the position all the time. The position where you're holding them, which arm, which side. On the changing table, put their head on one side one time and on the other side another time. It's easy. I'm guilty of this too. I feel like I'm a lefty where I'm always changing with my kids' heads on the left side, and then they're always looking to me to the right. In the crib, flip so that the opposite direction. So their heads on one side one night and their heads on the other side another night. We have a list of neck stretches that you can do if it gets to be more severe that I'm happy to send you if you need them. Placing toys. So if you're noticing your child isn't able to turn to the right very well, placing toys on the right side during tummy time to get them to look to the right. Speaking of that, tummy time is one of the best things that you can do for any child, and getting them off the back of their head will really help to prevent flat spots from happening. We have some cushioned, I don't have them, we can send you a link to some cushioned head supports that your baby can use during sleep. There's some that are safe for sleep to use, that can also take some of the pressure and distribute it more evenly on the back of their head. So something I hear a lot is that the only thing you can do if your baby has these flat spots is to get a helmet. That's simply not true. In some cases that are extremely severe, yes, a helmet is needed. But chiropractors like us specialize in cranial work so we can help care for these kids conservatively. Sometimes a helmet is needed, and that is amazing that we have technology that can give us more assistance. If your child is in a helmet, it is absolutely essential to be getting them adjusted consistently through that process. Picture putting a football helmet on your head for like 3 to 4 months and what that would do to your neck. It would hurt. It would stress you out a lot. And we have developed cervical curves. We have muscles. We have a nervous system that's developed. Now imagine your baby who has none of those things. Helmets put your baby into a state of flexion. It puts a ton of extra weight onto their developing necks, and it can cause a lot of side effects if they're not cared for. This is absolutely not to say don't go get a helmet, because we have tons of patients that we recommend them for when it's needed. This is just to say that to manage them conservatively when possible is a great idea. If your baby's in a helmet, getting them corrected during this time, getting their cranial bones moving is going to be drastically helpful for the inside. If you're just taking a helmet and pushing onto different spots and forcing the skull to go in a spot that it doesn't want to go, it can cause internal compensation patterns and can actually make the problem worse. It's likely to make your kid's head look really great, which is awesome, but sometimes it can cause internal stress if we're not taking care of the other things. So if you look at this little guy, we see all these cracks. These are called sutures. And each one of these sutures is here because as their head grows, the bone can't grow as fast as the brain. So the brain needs these relief joints to be able to expand and open up. And if one of these joints, say if I were to put glue on this joint and not let it move, and all the other ones were growing just nice, this baby's head would grow like this. It would grow like that. So then we'd get a flat spot right here. So my job is to evaluate the position and the motion of all these little sutures and adjust them very gently to get them to open up, and then over time we can see them move, which is really cool. We have so many kids right now that are dealing with this, and we're getting crazy changes in these kids. I absolutely love seeing it. If you have a child who has a flat spot and you're concerned about it and you want help to see if it's something that you should do more for, or if you know somebody who does, we are happy to get you guys in and to help. Have a good day, guys.